We are recording.
Hi, I'm Teresa Zimny, and I have here with me today Laura Keller, who is our Director of Public Health Nursing in Napa County at the Health and Human Services Department, Public Health Division. Laura is an expert in public health nursing and its impacts on childhood development and outcomes. Thank you for joining me today, Laura.
Thank you for asking me.
So Laura, could you describe for us, just generally, the practice of public health nursing?
Well, I'd love to, because it's something I'm really passionate about. And one of the things that's really unique to public health nursing is it really combines the art and science of nursing in a way that I don't think other parts of nursing do. And it has a long, rich history that goes way back to Florence Nightingale in London, and then the Henry Street settlement in New York, where nurses actually went out into districts and neighborhoods in those cities and into the slums and took care of neighborhoods, doing home visits, doing community work, doing all this really important work for people who lived in poverty and without sanitation. And back then there were, of course, really high rates of infectious disease, and saw that that kind of care actually really helped people and neighborhoods get better. So public health nursing is sort of based on that model of district or neighborhood and home visiting nursing.
Hence, located in public health
Departments,
settings
right.
versus hospitals, clinics. So, in your experience, what are some of the misconceptions that the public or people in general may have about the profession?
I think the biggest thing is that it's an invisible profession. Most people don't know about it. They don't even know what public health nurses are, and they don't know the work that's going on sort of behind the scenes in the community. So, for instance, we have nurses who work in communicable disease and nurses who work in maternal child health. We have nurses who work in immunization clinics and then California Children's Services. And the field nurses, which means nurses who work out in the field and go out in the community, you know, they're out there every day driving in their cars, going into neighborhoods, going in people's homes, going to doctors' offices, in this sort of rich network of community that sort of isn't known or seen by the general public. So that's one thing. Public health nursing is invisible. And then people often think that public health nurses are home health nurses, but home health nurses are different. Home health nurses are usually affiliated with a hospital, and when people are discharged and then they go out and they work under doctor's orders, let's say to do give someone an IV or do wound care, things like that. Public health nurses are independent practitioners. They carry their own caseloads and they work independently in the community, and they don't work under doctor's orders.
So do they do things like give injections when they're in the home, or any kind of medical treatment, or is it really a case management function working with
Yeah, it's a
families?
little bit of both. So public health nurses have bachelor's degrees in nursing, and you also have to have a public health nursing certificate from the state.
Okay.
And all nurses are trained in physical assessment, so they can physically assess people in the home, whether it's a mom or a woman who just delivered, an adult or a baby or a child. And they don't usually do sort of more typically task-oriented nursing, things like change wounds or put up IVs or give medicine, but they do all the teaching around those things, and they also do complex case management. So they're usually serving very high-risk clients in the community who have multiple needs, who have trouble accessing the healthcare system or the social services system, who need help navigating systems and also getting into care.
So could you illustrate for us, in a case example, the impact that public health nursing has on a family, and then as a ripple effect on the community as a whole?
Well, I have one really good example from our own public health department. So way back in the early 90s, when all the first information started coming out about infant brain development, all the new research, one of the things we decided is that we wanted to bring Barry Brazelton to our community. And that that was a long process to get Barry here, but he came in 1994 with his national seminar series, and he gave a lecture, which he does all over the country in those days. And when he was here, he sort of fell in love with our community and with the health department. And then he went back to Boston, and later he called our public health manager at that time, Christy Brandt, and asked if we wanted to be one of the first sites in the country to roll out his Touchpoints model. So we were selected with 2 other sites in the country to be the pilots for the rollout of Touchpoints, and that's his relational, empathic, strength-based model of care. And so Christy went to Boston with one of the pediatricians in town, Ralph Myers, and they became Touchpoints trainers. They came back and started training that model in the community. And since that time, I'm part of the training team. Since 1997, we've trained over 800 people in the community in Touchpoints, and those are all providers of some type. So doctors, nurses, childcare people, therapists, every agency in Napa that serves the perinatal population has staff trained in Touchpoints. All the public health nurses. It's been used as the basis for maternal child health, public health nursing, the therapeutic child care center, the Welcome Every Baby program, the infant parent mental health fellowship have used that conceptual framework and model as a basis for doing service. So it's had a wide systemic effect in the community, that kind of approach.
Wow.
But sort of married to that was at that point in time in '96, we decided to do a research project using Touchpoints with field public health nursing to show that it actually worked. So the premise of that is that if you focus on the relationship with the parent, between the parent and the home visitor, and you use that as a model for helping the parent to learn to nurture their child and fall in love with their baby, which supports attachment and brain development, that would be a profound model of care and have a positive effect. So we did a research study. We had a control group of mothers who didn't have a home visitor, and no one trained in Touchpoints came to talk to them. Then we had a group who had a public health nurse not trained in Touchpoints, and then our research group was the group of public health nurses trained in Touchpoints. So they met the mothers prenatally, followed them after the baby was born until 6 months of age, and then we did a battery of tests, tools and evaluations. And when we got our data back, we were shocked at the results because we got really amazing, positive, statistically significant results. So one of the things was in terms of development using the ASQ, that the babies scored much higher than the other groups. We used the NCAST teach on the babies, and those babies scored significantly higher, which is a measure of attachment and the relationship between the mother and baby, which is linked to higher later IQ. We had used a stress profile, and parents did better, were less stressed. Mm-hmm. We used the Edinburgh postpartum depression scale. We saw less depression. We had higher rates of well child visits, less sick child visits, better immunization rates. And then we also saw, we used a measure of satisfaction with providers, and the Touchpoints families had higher rates of satisfaction with their providers, kind of showing that if you have a good relationship with your home visitor, it provides a template for other providers in the community. The best thing was the breastfeeding rates were really significantly higher, and because we know breastfeeding is related to attachment and brain development and physical health and improving the immune system and prevents obesity later in chronic disease, it was fantastic results for us. So that's at a time way before evidence-based practices, we decided to use that as an approach in maternal child health for public health as a way to really do primary prevention.
So I remember being a new parent back in '89,
right,
and didn't have the first clue other than, I love my baby.
Right.
But there would be these milestones and events that I just, what do? You always want to do the right thing as a parent. I remember somebody referring me to the Brazelton
Right.
Touchpoints book, and my husband and I found that such an invaluable resource. So I can only imagine then taking that and implementing that in a community. It's fantastic. So thank you,
You're welcome.
Laura. This is a great introduction and overview of the public health nursing practice here in Napa County and how it so positively impacts community health. Thank you.
You're welcome. Okay,
Trying to see if I can.
is that okay?
That was great.
Okay.
That was great.